Anybody else that needs recording capability, if you don't already have it, just send me a chat message and I will make that change for you. So thanks again for coming today. It's UNC Health's weekly media briefing. We're trying to really give you a variety of subjects, and today's will cover a number of areas. So we'll talk about, is it safe is sort of our theme today, and looking at all kinds of activities, quick hit on whether or not they're safe and how to partake in them if folks so choose. And these have been pretty popular for us across our website and also talking with media. So I will get us now, let me change this to speaker view, and then we will turn it over to Alan Wolf, and Alan will introduce our guest speaker for today. Alan?
Thanks, Phil. Dr. Emily Sickbert-Bennett, thank you for joining us. She is an epidemiologist and an expert on infectious diseases. She is also Director of Infection Prevention at UNC Medical Center in Chapel Hill, and in that role has helped lead the effort to keep our patients and staff safe during this pandemic. She's also been a key contributor to a series of online stories we've put together called Is It Safe, related to things like travel and going to the beach and going on play dates. Those are all available online. Emily, thank you again for joining us. Would you like to make a few opening remarks about your work during the past few months and sort of what's next?
Sure, of course. Thank you for having me. Good morning, everyone. You know, here we are now 5 months into the COVID pandemic, and we in North Carolina have reached our highest point of cases to date. And many people are asking, what's next? How can I go on? What are the things that I can begin to do? And one of the things that has been so important that is to really apply what we've learned about the pandemic in terms of prevention strategies going forward. So what we have learned over the last 5 months is that coronavirus is spread in the manner that we most thought it would initially, which is largely through droplets from the air from an infected person to another person who's susceptible. Secondary routes of transmission are fomite, meaning that you touch a contaminated object, your hands may become contaminated, and then you could inoculate your nose or mouth with a contaminated hand, but that is thought to be very secondary route of transmission. So really thinking about how those routes of transmission play into our prevention strategies. In infectious diseases, we think about a whole chain of events that has to happen in order for transmission to occur, and how do we break that transmission? So there are 4 key things that I think everyone needs to stay focused on. And I know everyone feels tired and worn out 5 months in, and thinking about just focusing on these 4 key things that will break the chain of transmission that we can really turn this pandemic around. The first one is wellness and staying home when you're sick. The second being wearing a mask. The third being physical distancing. And the fourth being wash your hands. And each of those mechanisms really serves to interrupt the key transmission routes for coronavirus and will allow us to really think about what strategies we can take back on. In the spring, we turned everything off like a switch. It was on and then it was off. And now as things begin to reopen, we have to think about how we dial back into some of those activities, thinking about what's most important for you and your family, and then how to do those activities safely, knowing the best ways to interrupt the chain of transmission.
Emily, thank you. Why don't we go ahead and open up to media questions, and if no one jumps in, I've got a few of my own, but if anyone wants to step up, you know how we do this. Just take yourself off mute and start asking questions.
Hey,
go ahead, Richard.
This is Richard Stradling at the News and Observer. I was wondering if you think it's possible to safely hold a state fair. We know that the Agricultural Commissioner is having a press conference as we speak, and I'm not sure exactly what he's saying, but I'm wondering what your thoughts are on whether it's possible to hold a state fair and what you'd have to do to make it safe if you were going to hold one.
It's a great question, and certainly the state fair is an opportunity where individuals from all across the state of North Carolina and beyond can get together and mix in one location. So really thinking about the numbers of people that interact is key, and thinking about how we could potentially reduce the number of attendees so that we could achieve things like physical distancing. That would be really important to consider in that space. It is a largely outdoor type event, which is a better situation for achieving physical distancing. The other real challenge, I think, is that mask use is, as we said, one of the keys for interrupting transmission. And certainly mask use can be required for these types of events, but one of the times when we know that mask use just isn't feasible is when you're eating and drinking. And of course, eating is a large part of the fun for people at the state fair. And so anytime when you're not wearing your mask, you really absolutely have to achieve 6 feet distance. And so that is really, I think, the biggest challenge in trying to think through how to have a large number of people who may have masks available, but may be removing them as they eat and drink in that type of setting.
If you want to just jump in here, Tyler Stotts, thank you, Tyler, reported that the state fair has been canceled. So I don't know if you want to expand your remarks around that, knowing that that's the case right now.
I think that makes very good sense, considering just as we are at our highest peak of cases at this point. As I said, you know, mask use really can't be achieved 100% of the time if you are in an environment where you're eating and drinking. Certainly the state fair is no stranger to implementing infection prevention measures. Several years ago, they had foodborne outbreaks linked to animals, and they implemented better hand washing and signage and changed the way they routed or didn't allow visitors into the petting zoos. So we know that you can implement some of these strategies, but the idea that everyone would be mixing in a new pattern is really a bit concerning, considering the high number of cases that we're still seeing in North Carolina today.
Here was a question that was texted to us. This is from Rose Hoban, and Rose has said she's curious about transmission outdoors. All the advice is typically that outside is less risky, but then she says there seem to be some instances where there has been transmission in outdoor settings. Could you talk about best practices for outdoor settings and events?
It's a great question. Certainly, the risk of transmission is not a simple yes, no. It's really along a continuum. So one of the things that we know is helpful in disease transmission through the air is to have more air and more space, and that is achievable much better in an outdoor setting. You could certainly imagine an outdoor setting where people were congregating in small groups, and that would be problematic in that way as well. So everything that we do with reducing our risk of transmission and each of these strategies to break the chain of transmission is really an additive type benefit. So the mask is a belt, if you will, and physical distancing is suspenders. And if we want the full protection, we can implement both of those things. And physical distancing is much more achievable in outdoor spaces, and you have more room and more airflow.
Couple more questions. So Helen Chickering says air travel has been picking up during the summer, and what are your thoughts about the risk of in that setting? And people think about planes, but also the airports themselves, airports and planes.
Airports and airplanes obviously are a place where a number of different people are interacting and mixing in new patterns as opposed to your usual group of people in your community. So it's certainly something to be very cognizant of, whether or not it's really an essential activity for you to undertake and whether or not that's the right mode of transportation for you. on an airplane setting, we think about how many people are on that airplane, the airspace, the closeness of other people nearby you, and whether or not masks can be achieved 100% of the time by all those individuals, whether or not the airlines will enforce the masking. If it's a very long flight and people will be eating and drinking, how will that be achieved if people need to remove their mask while they're eating and drinking and you're in close proximity to other people? So it's certainly a consideration that some of those control strategies that are so important might be harder to implement in that setting.
Another question that was chatted to us. So are there any activities that you think of that, used to be considered more safe that are now considered problematic after we've learned more about coronavirus?
That's a great question. I think we really had a very good sense early on that coronavirus was transmitted by the droplet route. We've certainly seen other infections with not novel coronavirus, and it was behaving in this same way. So I don't think that anything we've learned has changed our strategy on what is safe versus what isn't. I think simply we need to really fine tune and hone our messaging on those things that are most important. For example, one thing that was emphasized very early on is the potential for fomite transmission or surface contamination. And that certainly is a possible route of contamination, of transmission. But if you think about the whole chain of transmission that needs to happen for a contaminated item to make you sick, it's actually very clear that that's not what we need to be focusing on most specifically. So if you are shopping in a store and someone were to be infected, cough or breathe on an item in a certain place, that item would need to have viable infectious virus remain on it, survive on that surface for long enough for you to come into contact, touch it with your hand on the exact location, transfer it to your hand, survive on your hand long enough without any hand washing, then your hands to come in contact with your mouth or nose and actually transfer the virus to yourself to become infected. So the efforts on thinking about surface disinfection are not entirely misplaced. It's great to have clean surfaces and clean environment, but when we think about what matters most in transmission, it's really hand hygiene, in particular before we touch our nose and our mouth. And that's another wonderful benefit of masking, is that it does prevent that inadvertent contact when you might not be thinking about it with your nose and mouth.
Great. We've got a couple of chat questions that we'll get to, but are there any questions that someone would like to just ask?
Yes.
Go right ahead, Andrea.
Yeah, thank you so much. Just in light of what you just said about how it's transmitted, can you speak more specifically to the scenario of outdoor playgrounds and whether that can't be considered safe at this point in the pandemic, given what we know about how it's transmitted, some precautions that families could take, especially since we know that schools are allowed to welcome students back at this point indoors. What is the holdup around outdoor playgrounds in your opinion? Thank you.
Great question. The issue of outdoor playgrounds, I think, really goes back to whether or not we can restrict how many people are in close proximity to one another. So playgrounds by their very nature are fun, attract people to certain aspects of them. And when children are involved, it can become hard, certainly, for them to remember to keep adherent to the distancing. So playgrounds are outdoors and certainly could achieve the physical distancing, but would need quite a bit of enforcement really to keep the children separate from one another. And then they would have to, of course, be vigilant about any hand hygiene if they were having a snack on a picnic blanket away from the playground. That would be really important after they were on the play structure.
And this is all just a quick follow-up to that, because we've heard Health Secretary Dr. Mandy Cohen talking about how young children especially are less likely to get spread and become severely ill from the virus. So even knowing that, you're saying that it would still not be a good idea to have children playing together outside.
I think if the numbers of children could be restricted, if there was a way to really ensure that there wasn't a huge crowd in different playground settings, that it can be a safe environment for children to play together. Certainly a better environment than an indoor play structure, for example. And the issue with children becoming less severely ill, I think, is an important one when we think about that cohort and how they will likely experience the virus. But it also is important to consider that they have interactions with many other age groups, people in other risk categories. So while they themselves may not experience a very severe form of the disease, they are capable of transmitting it to others, where it could cause some problems.
Here's a question. Says, could you talk about the role of UV light? Is there enough of the right kind of UV light in just sunlight to disinfect surfaces? How much time is required if you're using UV light, and is heat a factor? And I mean, could you address that? I mean, we have heard about that, I think, really early on in the pandemic, we heard about that, but not recently.
Certainly all environmental conditions play a role in how long viruses and bacteria can survive on surfaces. We know that UV light kills off pathogens over time. Heat, just time in and of itself in terms of survival. So as I mentioned in the chain of transmission, when we think about survival on surfaces and the role that plays in terms of transmission, just the environmental conditions do certainly play a role in die-off of the virus over time. Some of the studies that have been published on survival of coronavirus on surfaces can be a little alarming just taken at face value, because they are intended to really show in an experimental way what can happen when you put a very large volume of the virus on a surface and watch the die-off over time. But in natural conditions, the virus is susceptible to all of these factors, including UV light and time, temperature, and humidity.
Hi, I've got a quick question or two. Can you tell me whether there should be more explicit directions to people who want to have family gatherings about who's safe to be around? I've read a couple of things where people have gotten sick and whole families have gotten sick after a gathering. One in Catawba earlier this month, and then another. I mean, they come up all the time. Should there be more explicit messages to families about family gatherings and who's safe to invite and how big they should be? And another question I've got about beaches. Are beaches safe to go to? Because I've heard some conflicting messages about that. I mean, I could think on one of these Zoom calls, someone said that beaches are okay because it's kind of like natural air conditioning. But then I read about people going to beaches and getting infected. So what is your thought there?
Great. I'll take the first question on family gatherings first. Certainly, just as we said, anything, the greater the number of people you're around, the higher the risk of transmission is. I think one of the really most important messages around family gatherings and really any activity that isn't highlighted enough is the idea of wellness. And that we now know, one thing I would say that we do know a little bit differently and understand differently over the last 5 months is how diverse the signs and symptoms of coronavirus can be when they first present. So we initially thought it was really fever, cough, and shortness of breath, and anything other than that you were good to go and carry on. But now we know that many people are presenting with milder symptoms, but they can be infectious even with those mild symptoms. So it's really important for, especially at family gatherings, to just be so honest and so open and really tell the family that's involved, we love to see you, we want to see you, but not when you're not feeling well. If anything doesn't feel great, that's not the time to go to a family gathering, that's not the time to do grocery shopping, and that's certainly not the time to go to work. And I think that there's a lot more we need to do to break down the barriers to preventing people from going out when they're sick. There are reasons that relate to financial reasons, workplace, HR policies, just fear of missing out, not understanding the severity of it. But all of those cases that you mention and stories start with somebody who attends a family gathering when they're not feeling well. So that is, I think, the most important piece of advice to give when people are planning family gatherings. The second question about beaches, I would say, really goes back to our outdoor environment situation, that there's space on beaches, on most beaches, at least most North Carolina beaches have space to keep a distance from others. And so that is the best type of environment if you're going to be out in public, to find places where you can keep at least a 6-foot distance from others. When people are infected because they go to the beach, there might be other activities that they're doing while they're on vacation at the beach that would bring them indoors to indoor environments, perhaps where people aren't wearing masks. And certainly that is a different situation than just physically being on an open air beach.
We had Tyler Stocks at the Johnstonian had a question about a sort of more general one. I haven't heard this one before. It's like, do you feel that people are leaving home too often and unnecessarily with the stay-at-home order having been?
I'm looking into both of those media briefings to see which one is more. There's a deep one where they're talking about.
Are they leaving home too often? I think this has been a bit of a struggle, really, in part because in the springtime, everything shut down so quickly. And so when things reopened, it has been a real change of mindset that reopening isn't just a return to back where we were in January and doing all the same things. And it is really important because every interaction you have, it does expose you to more individuals, and certainly all the measures that I mentioned are really key for preventing transmission. But it is very important for every person and every family to think about which activities are the most important and start by turning that dial really slowly for those activities that are most meaningful to them.
Tyler had also asked one question since he helped us with the fair reporting. Are common activities like hiking, going to the gym, swimming, going shopping safe? And then also many people are either not wearing masks or not wearing them correctly. Could you just, I mean, you already have commented on masks a bit, but what about just doing these everyday activities like hiking, going to the gym, whatnot, and shopping?
The way I would think about all those common activities is really the same mindset, thinking about you not doing everything you did back in January and February, but which among those things are most necessary and most important to slowly add back in, and then making sure that you're following each of those really key transmission prevention strategies. In outdoor environments, give you more room for physical distancing, and so you have an added layer of safety there. Certainly if you're doing indoor activities, you want to be sure that you're going to places where other people are wearing masks and that you're wearing your mask and that your mask is being appropriately worn to the point that Tyler makes. The mask should be completely covering your nose and your mouth in order to be effective.
Great. Questions from the media, not via chat, but just go ahead and ask if you've got some. Just jump right in and ask. Okay, another quick question.
Well, hold on.
Go ahead, Richard. Go ahead.
Yeah, I'm interested in your thoughts on the closing of bars at either 10 or 11 p.m. Does that make sense? And why does that make sense? And does it matter really what time they close?
To be honest, I wasn't aware of this new specifics on the closing hours, but if you think about the risks within a bar, just to speak to that transmission route specifically, that's certainly a time when people are often continuously drinking and sometimes eating as well. And so that is an environment where mask use is a challenge and is not going to be consistently applied. So it is important to think about what other strategies could be important in that way.
And another similar question was about outdoor dining. We see that that seems to be more popular now, obviously, in some places. Are there any best practices for mitigating risk on that?
Certainly, we know that outdoor is safer just because of the airflow and the greater volume of air that moves around outdoors as opposed to indoors. So to the extent that restaurants can offer outdoor seating, eating is a time when your mask can't be worn. And so that's a time when one of your belt and suspenders strategies is not there, and the other one has to be achieved to the maximum level, which means at least 6 feet distancing, if not more. And if it could be done outdoors, that would be even safer as well.
We talked about beaches. There was a follow-up to that. What about pools? And I guess not just your private backyard, but if you have a neighborhood pool, or if you belong to a club where there's a lot of folks there, what's the thought about that? It's outside, but then you also have a lot of folks really close to each other.
For a pool setting, exactly as you said, the outdoor setting makes it safer, but it's still an area where you would want to make sure you're reducing any crowding. If there's a snack bar where people would congregate to get in line for snacks, that would be a place to require mask usage, physical distancing, keeping any chairs and tables spaced far enough apart. Luckily, coronavirus is not known to have a waterborne transmission, so inside the pool, maintaining distance just from other families as you're playing is important, but there are certainly strategies that can make outdoor pools a safe environment.
So we have just a couple of minutes left. So if we have any additional questions from the media, please just jump right in and ask away.
Emily, could I circle back to the point you were making about people staying home from work if they're not feeling well? What are some things that sort of need to happen to make that a little more acceptable as we head into the fall and more people maybe start returning to work?
Yeah, it's a great point. And I think one thing that we have learned over the last 5 months is that sometimes some of our jobs that we thought were vital to be in person, showing up face to face to interact with others, can be done in a remote way. So I hope that's something that could be a long-term strategy beyond our COVID pandemic, is to think about offering, when appropriate, in workplace settings, remote ability or working from home on days when you don't feel well. I think there are a number of reasons, and they affect people differently in terms of why they might come to work when they're sick. Sometimes it's because workplaces don't offer paid time off when you're sick. Some workplaces have punitive strategies when you have too many absences from work, and those can be real deterrents from people staying home when they're sick. And I think that some of the outbreaks that we've seen were direct results of workers who didn't feel empowered and comfortable always to stay home when they were feeling sick. And when we think again back to the chain of transmission, it all starts with someone who's infected. And so to the extent that we can remove symptomatic infected people from public spaces, workplaces, out in the public, in shopping areas, that we really need to be talking more about this and making sure that our policies and our practices and our incentives align with people being honest and faithful about staying home when they're sick.
Great. Well, we are out of time. I'll just give one last shot. Is there anybody that has another question before we conclude?
If nobody else does, let me ask about people who are not infected and the risk of, I'm sorry, not symptomatic. People who may be infected but don't know that they're sick. Do we know any more about how common that kind of transmission is?
I think we still have a lot to learn about how effective that transmission is, how common it is, and then secondarily, how effective it is. Some of the early studies that reported asymptomatic transmission were back when we really thought the key symptoms for coronavirus were fever, cough, and shortness of breath. So when individuals were interviewed to ask if they had symptoms, they were asked, do you have fever, cough, and shortness of breath? And if the answer was no, they were classified as asymptomatic. So now we know that there are a number of other symptoms that are milder, sometimes even GI symptoms that can be associated with this. And so we really do need to understand better the role for asymptomatic transmission. From everything we understand with infectious disease transmission, it certainly is not as effective way to transmit just because you're simply not having as high viral loads, you're not excreting in the same way into the environment. So even just focusing on the symptomatic individuals and making it the right and easy thing to do to stay home when you're sick would go a very, very long way for us.
Great. Thank you so much, Dr. Sickbert-Bennett, and thank you everybody for joining us today. As usual, we will post an audio and a video file on Dropbox, so you can download those just as soon as we can get those up. And then we'll also put it on YouTube. And if you're a radio outlet and you just want the audio, we can email you the audio. It takes us a little bit of time, but we should be able to get that pretty quickly. And again, thank you, Dr. Sickbert-Bennett. And thank you, everybody, for joining us today. And that concludes our media briefing for today.
Thank you.
Thank you.